Leukoplakia is a condition characterized by white patches or plaques that form on the mucous membranes of the mouth. These patches are usually non-cancerous, but some can show early signs of cancer. Recognizing and understanding leukoplakia is essential for early intervention and prevention of potential complications. The exact cause of leukoplakia is not always clear, but several factors are known to contribute to its development. Tobacco use, both smoking and smokeless tobacco, can irritate the mucous membranes, leading to leukoplakia. Alcohol consumption, heavy alcohol use, especially when combined with tobacco use, increases the risk. Chronic irritation, rough teeth, ill-fitting dentures, or constant biting of the inside of the mouth can cause chronic irritation that may lead to leukoplakia. Sun exposure, prolonged exposure to the sun can cause leukoplakia on the lips. Leukoplakia typically presents as white patches that cannot be wiped off and may have the following characteristics. Texture: the patches can be smooth, thickened, rough, or slightly raised. Size: they can vary in size, from small spots to large patches. Location: commonly found on the gums, inside of the cheeks, bottom of the mouth, and sometimes the tongue. In some cases, leukoplakia can cause discomfort or sensitivity, but often it is painless and may go unnoticed. Diagnosing leukoplakia involves several steps. Physical examination: a thorough examination of the mouth to identify any white patches. Biopsy: a small sample of tissue may be taken from the patch and examined under a microscope to rule out cancerous or precancerous changes. Medical history: reviewing the patient's medical history and risk factors, such as tobacco and alcohol use. Treatment for leukoplakia aims to eliminate the source of irritation and monitor for any changes that might indicate cancerous development. Removing irritants, quitting tobacco use and reducing alcohol consumption are crucial steps. Dental care: addressing any dental issues, such as rough teeth or ill-fitting dentures, to reduce irritation. Medications: in some cases, medications may be prescribed to help reduce the patches. Monitoring: regular checkups with a healthcare provider to monitor the patches for any changes. While most cases of leukoplakia are benign, there is a risk that the patches can develop into oral cancer. It is essential to monitor changes: keep an eye on the patches for any changes in size, color, or texture. Seek medical attention: consult a healthcare provider if any changes are noticed or if there is persistent discomfort. Preventing leukoplakia involves reducing risk factors and maintaining good oral hygiene. Quit tobacco: avoid both smoking and smokeless tobacco products. Limit alcohol: reduce alcohol consumption. Dental care: regular dental checkups and maintaining good oral hygiene. Protect lips: use lip balm with sun protection to prevent sun damage. Understanding the causes, symptoms, and treatment options for leukoplakia is vital for early detection and prevention of potential complications. By eliminating risk factors and seeking regular medical advice, individuals can effectively manage and reduce the risks associated with leukoplakia. If you notice any persistent white patches in your mouth, it is important to consult with a healthcare provider for a proper diagnosis and appropriate management.